We are going to take you live to Ottawa now. That is where Federal Health Minister Mark Holland is speaking on the new pharmacare bill. Let's listen in live.
We had to hold inside our vociferous and enthusiastic agreement. And so thank you for all your patience as you said that. To Frédéric Chabot from the Canadian Action Canada, for sexual health and rights, who's also been such a staunch and powerful advocate. Dr. Black from the Society of Obstetricians and Gynecologists of Canada for all of your advocacy. And then I got to turn to the community of diabetes. And there are so many people that it's impossible for me to be able to name anybody individually. But I really want to thank hugely Diabetes Canada and JDRF for their relentless advocacy to get us to this moment today. It wouldn't have been possible without them speaking up on behalf of patients. And, you know, I also want to recognize Raina, who I'll come back to. Raina, who's a 12-year-old advocate for JDRF. I want to thank my colleagues. I obviously, Marcy and Yasser, but all of the colleagues whose relentless push to move forward was so instrumental in this process. It is such an honor to work with all of you. We have such an extraordinary team. I'm so proud to serve with under our Prime Minister. And Dawn, maybe you come over here for just 1 second, because I want to first start by shaking your hand. Dawn, you know, it's rare in politics. We're two different parties. Obviously, we have a lot of different views on a lot of different things. But, you know, over the last, 8 months or thereabouts, you know, they were very vigorous conversations. They were very hard conversations. There were many moments where I think both of us wondered if we would get here today, but we did. And it's a testament to who you are, Dawn, to your focus on trying to make things better and trying to find solutions instead of find differences. And I really appreciate and honor you in that. It was a privilege when I was a critic in opposition to work with you on public safety issues, whether or not it's on dental or here on pharmacare. I think we're able to do tremendous things by finding that common ground. So, Dawn, thank you so much.
Today, as I've said, this is a truly historic day. It's a historic day to improve health for all Canadians, with a huge impact for our healthcare system.
When we think of the pandemic and the stresses faced by healthcare systems around the world, it's easy to despair. To believe that the strength of our public health system and its best days are behind us. But, you know, in that moment in the pandemic, instead was seen a light of what was possible when we all work together, when we focus on collaboration and we focus on solutions rather than on differences, egos, and jurisdiction. And it is exactly that spirit that brings us here together today. And, you know, you think about the advancements we're making, having signed agreements now with British Columbia, Alberta, Manitoba, Ontario, Prince Edward Island, Northwest Territories, and Nova Scotia, and every province and territory to come, to make historic investments. $200 billion being invested over the next 10 years in our public health care system. But we recognize investing in primary care, investing in ensuring that we have the right workforce and that we stand with the incredible individuals who provide us health care in every corner of this country every day is not enough. That we must cast our eyes upstream. Being upstream is just as important as dealing with the conditions that we're dealing with in the current context. That's why our government took historic action on bulk purchasing to reduce the cost of drugs in Canada by hundreds of millions of dollars. That's why we took action on drugs for rare diseases. And that's certainly why we took action on dental care. And it's most certainly why we are here today. Today in the House of Commons, I was deeply proud to introduce an act respecting pharmacare that lays out the principles essential for a national universal pharmacare in Canada and sets out our plan to provide universal single-payer coverage for a range of contraception and diabetes medications. And someone might rightfully ask, why these two drugs? So let me take them each in turn. Let's start with sexual health. And here I turn to the advocates who've spoken so passionately over the years about how autonomy over one's body, over the ability to have access to the reproductive medicines that you need to control your own sexual health is a matter of fundamental justice. Waking up in a country where every single woman has access to the contraception she needs to control her future is an absolutely critical part of having a just society. This is about health equity. It's also about affordability, about making sure somebody who's asking, can I afford the contraception that I need to be able to control my future? Or do I pay for rent or food in a time of global inflation and challenge? It's about giving women control of their own bodies. And folks, it's also about destigmatizing conversations about sexual health. Sexual health is health. We should have the ability to talk about any body part with no shame. And those direct, honest conversations about our sexual health are so essential. Because when we avoid conversations about sexual health, that leads us open to manipulation, to sexual violence, and poor health outcomes. There are more than 9 million women of reproductive age in Canada. That's nearly a quarter of the population. Unintended pregnancy can be a cause of a cascade of health and economic impacts, both for individuals and for society. Having safe, reliable birth control is essentially freedom, and it is safety. However, these costs continue to be a barrier. Today, we're taking action to remove that barrier. Next, I'll turn to diabetes. And maybe if I could go to one of the most powerful advocates here in the room today. 12-year-old Raina. Raina said to me, she was talking about how hard it is to manage diabetes, how much work has to go in and thought every day to managing your condition. And that's a lot for a 12-year-old person to deal with. But Raina reminded us that imagine at 12 years old, as you're trying to manage that very difficult disease, if you wonder whether or not you can afford medication, if you wonder whether or not you can afford the test strip or the syringe that you need, you got enough to worry about, Raina. You don't need to be worried about cost. And that's one of the reasons why this is so fundamentally important today. You know, when I had an opportunity to talk to Sarah here earlier today, Sarah is doing incredible work in diabetes, as so many are at the Centertown Community Health Center. Sarah was saying to me, imagine I have clients who, because of money, are reusing syringes, taking on the danger, the incredible health danger of reusing a syringe because they don't have the money for it. That's not right. That's not the kind of country we should live in. Talking about patients who are making a decision about whether or not they take their diabetes medication or whether or not they go and get the food that they need for their family. And what happens to that person who doesn't take their medication? Right? They wind up potentially with an amputation, with a stroke, with a heart attack. They walk out with potentially kidney problems. That's not just a matter of social justice. Imagine the cost involved in that to our health system. And I don't think that's the kind of country we want to have. And that's fundamentally about what we're talking about today. And here I'll make another point, which is that many will talk about how much this costs. I hope that we talk about how much it saves, not just how many lives it saves. But in the British Columbia example, and I want to thank Adrian Dix, who was, the work that British Columbia did to lead the way on universal contraception, has demonstrated really that it appears to be saving more in money than it costs. Here's a remarkable situation where we will work with provinces. Je vais travailler avec chaque province, avec chaque territoire, avec une esprit
province, each territory, with a spirit of cooperation to increase prevention, because it's about reducing the cost to our healthcare system.
If we think outside of the crisis we're in, we can light a candle to what is possible in our health system. While we make the investments in primary care and health workforce, we so too could be making the investments that are stopping the crisis from ever happening again. This is fundamentally an important day for Canada. It is one for which I am so deeply proud. And I will end on this note, and I usually don't write things, but I wrote this. If I can find it. There will be a debate, folks, and we know this has already started. There will be a debate about who gets credit here today. Is it the Liberal Party? Is it the New Democratic Party? Is it the advocates or a particular province or someone or something else altogether? This debate entirely misses the point. This deal was achieved because our parties, every day, in every way, centered the conversation on how we can make things better. It was our only focus. We asked, how do we stand on the shoulders of all of the advocacy and work that was done before us to find answers and not differences?
All right, Federal Health Minister Mark Holland unveiling the government's new pharmacare bill. The idea, your health card will cover prescription drugs related to diabetes and birth control. We're still waiting to learn a lot more about this new bill that was tabled today.